right foot, right hand, left foot. And this is a rhythmic movement, as Inga says, and as I say, when I hear a student say, advanced student massage, I say, that's wonderful. Because I know that they're feeling that they're doing the massage correctly.
Yeah, it's just a matter of shifting weight back and forth.
Now,
Inga, would you do an arm for me, please?
I would like to mention this, that when I'm doing that, I'm also having tension, which makes it much stronger, and for more professional. Correcto?
So you're putting the weight on this leg and you're bending on this one.
You may say that too, as you go. That tension is very important. Okay. Just do it real walk.
So I got my weight on that. Now I do it the right. Do it the other way.
So you don't do it.
Yeah.
Have to do it to see you have to look.
But it's a matter of, yeah, right. So you do it left to left, or right to left. And I shift back and forth.
Here's my left hand, I'm pressing down. I can do this. I'm standing on the right foot, I'm exaggerating, and now I'm shifting my weight to the left foot with pressure, right hand. Now left hand.
Yeah, I would have to consciously make that switch.
Yeah.
Because
Yeah.
that's not the way. I mean, it's a rhythmic movement, and in the beginning, you always exaggerate that
Yes.
until it gets to be part of you.
Right.
Right.
So that you don't, hurting yourself. Otherwise, things don't really work right. Well, that's interesting. I'd like to try to concentrate on
Did you want to try an arm
it.
movement?
It seems easier for me to
All right.
shift back and forth.
But I can still feel, I do feel the weight shifting from one to the other.
Right.
Yeah, I know.
The weight should.
But it's not quite as obvious as what everyone was doing.
My movements are slower.
So that's right and right. That's what
So
you're
he's,
doing.
and he's right, just what we teach bend, okay.
My foot movement is more subtle, or shifting back and forth.
Right.
More subtle.
You're doing more of a friction than
I don't, body weight is as good as Evan does.
I do Tai Chi, man.
I know.
Okay, let's move on to joint mobilization, maybe?
Right.
Rotations.
Yes.
I would say my position, the way I use my body would be more like what Ray is doing. And I think, again, it has to do a lot with the, the working with the Tai Chi, that, you incorporate more of that awareness of the, polarities.
And Inga had a very good point, too, in that he would shift what he was going to teach
Right.
for each person. Okay, let's roll into the fingers, and let's see if we're clear on what he wanted done with the fingers. Do you remember him corkscrewing both directions as he corkscrewed the fingers? And then, of course, he
I don't
hooked like
remember what
this.
directions now. It may have been, I don't remember.
You just remember going one direction?
But it's the opposite, with the other hand, do it the other way.
Well, yeah,
right.
Toward the outside.
Yeah, I understand.
Is that what you did it in?
I can answer
You
that
probably do it.
question. He didn't teach it in both directions. But he did say, if you can do something more effectively, do it more effectively. He didn't say, just do what I told you to do. He wanted the student to use his own intuitive knowledge. Well, this is observation. If I'm going to do it this way, I can do it twice as effectively this way, and therefore I will do it that way. Dr. Reilly did not teach me that. And here I'm using tension. He had those wonderful sayings, which I don't hear enough of here. Let your hands tell you what to do. Visualize what's happening underneath your fingers. I think that increases your sensitivity and your intuition.
Or that way, with a thumb up.
Now, as it happens, you find me not doing what I said before. With my right hand, I'm pulling, and my weight is on my right foot. It shouldn't. It shouldn't be. I can.
Careful about that should word.
Don't shoot on me.
Hey, that's right.
Okay.
Harold doesn't love to.
Yeah, I'll,
Don't-
In this particular movement, that's not too
So you have it.
significant.
Okay, and just like Ray added, you know, the
Yeah,
back
let's
and
press
forth,
this.
just like you say. The joint doesn't get that movement much. You do it a lot quicker.
But
That works.
Okay. You want your whole body?
Everybody in this
there?
room that learned from him has modified his routine.
I did what
you know?
Everett was saying.
I think we can
Cool.
be pretty sure of that.
I used a lot of intuition, like Everett was saying. He told
I want to get Terry in there sometimes.
sort of tune in,
Hi,
whatever
Terry.
feels
Hi.
right to them. You know.
Sorry.
I just use a lot of intuition instead of
Oh, this is
what
cool,
matter
man.
physiology. That's
Yeah, it really showed a couple of different techniques for the fingers because, you know, depending on the dexterity of the person, one was and it was pretty much always in the same direction, although I don't know that he ever said not to do both. And I can remember him sometimes doing both. It's a matter of feeling, you know, what does the joint need, you know. But otherwise, just routinely, if there wasn't, you know, some reason to do otherwise, you know, it would be just the same direction. And he didn't work back. He'd
It's
go.
easier and more rhythmic to do it that way.
Yeah,
for the
rhythm was a
practitioner.
very important aspect of what he was doing because not only is it good for your biomechanics, you know, be in any even rhythm, but also then the person, you know, just gets a whole different feel to it. So it's both more therapeutic and also part of the biomechanics. And also getting to the end, then you know you can easily pick up the other finger, and so it's efficiency as compared to working back. Then you have to, you know, it just takes longer. But the one technique that he preferred was actually kind of walking up the finger this way as you go around the circle, and it takes a little more coordination. But it's kind of like this. It goes around in a circle at the same time.
Yeah, no, he taught us.
Right.
Harold taught us
And
that.
then when you get up to here, you can use the little finger to grab that part. So then you've got traction. Okay, and as you're pulling down on that, then you can grab the knuckle. And you notice
Right.
also my hand is close to the knuckle here as compared to
that's
down
sort of
here.
what I ended up doing.
Yeah.
See, if you're here, then the action is not as specific. You know, you're moving the whole hand around, whereas the hand is up
And then
here.
joint.
Then you've got complete control over that joint, and now I can really do a lot to that. And I'm not just see this kind of emotion goes as you're working up, you know, sort of describing a cone. But then once you get up here, you've got a different kind of action. Instead of just doing this, now you can do this with the joint, which is a whole different kind of.
That's something our students have a lot of difficulty with in the second
Mhm.
semester. I see them making a circle with the tip of the finger
Yeah.
rather than really working up here on that joint.
Exactly. And so those are two different motions, and they're both fine, because this way, so you can work the extremes of emotion on that describing a cone. Then by the time you get up here, now you apply traction, and you can do this kind of emotion. And also a little bit of a twist. And he would twist in both directions, but mostly this direction. And then from there, using this finger, just right here again.
That's interesting.
Do that fairly quickly. The same thing here. You can either do it this way or.
When I'm on that side, I always use the left hand. This side I use right hand.
You mean
Sort
this?
of, yeah, sort of to
Yeah.
work both
Yeah, that's probably
of my hands and arms. You know.
that's probably a better idea. Some people can't do that too well, but
I couldn't. I mean, I just sort of force myself to do
yeah.
it. I don't know. I maybe don't do them the left hand as good when I do the left hand. Let me show you how I ended up. I don't know if this was. Let me show you your hand. I don't know if Riley taught me this or not, but this is sort of the way I ended up doing it. Grabbing like this and doing this like that.
Okay, do you have control of the joint when you do that, when you're
Oh
up?
yeah, you wrap these fingers around like that.
No, but she's
And
talking
this finger up.
about the
I'm
location
talking-
of
right.
that hand, this hand.
Do what?
Okay, you do, all
There,
right.
as compared with holding it up closer. This hand.
Right, that's what I was
Well, I'm-
wondering.
Yeah.
I know
Well,
that's,
I try to hold his hand stationary,
Right.
Oh, okay.
so I'm just rotating this. And this is rotating just like my wrist is rotating. See that?
Oh, okay.
So, yeah, see, because now you're up closer to the joint than
Mhm.
the first, that's what she was asking about.
That's
One
what I
time
was
you grab
concerned
here,
with,
one time you
'cause-
grab up here. And I think the closer you can comfortably get to the joint,
Right.
then the more
Yeah.
control you're gonna have.
a couple of years ago, I remember asking you specifically about that, and Riley did teach this position, but you showed me this too.
Well, any way you can
to
do it,
work
it feels
there.
better.
So,
you know, it
yeah,
feels
right. So
Just so
there are
you
different ways of
rotate that
holding that
joint.
finger to
That's
do
right,
that,
yeah.
here or here.
Okay.
And do you not keep a little traction?
Oh, definitely traction. That's
When
what
you
I
do
was
that.
saying about the using the pinky to,
Right.
to get
Traction.
traction on it.
But the important thing is to get that action in the joint, which is the real hard thing.
So,
Next.
Fingers, wrist.
Wrist, I heard two different things about the wrist rotations.
Okay, Joan?
Okay. One is to hold here, right in here, and do the rotations.
At the crease.
Okay, at the crease, and the other is to actually hold at the radius and the ulnar and do the rotations. So which is more effective? It's depends
Well-
on what you want to do.
I'd say as high up on the radius and ulna as you can get, because if you actually get into the joint, then your fingers are impeding the motion. So in order to have control of the joint, you want to get as close as is comfortable and practical to the joint, but you have to definitely be one hand on one side, one hand on the other.
Mm-hmm.
See, because if you're slightly below here, you can also do gliding in all directions and so forth. You can do everything, whereas if you're here, you can't really do that. If you're up here.
So you are, let me see.
If he's
Let me
right
see.
below the
Just
crease.
below the crease, so
here?
that you can,
It should,
The
yeah.
tiny, tiny bit. Yeah,
just
yeah,
below,
yeah.
you're where the
Okay,
where
I
the
can feel the
process, the
condyles,
stylate
yeah.
processes come out. It's right
And
below
not
there.
in the crease, but right.
Right below, okay.
Good release.
Well, that helps me. What's the question?
Okay.
He showed you the other one?
Um,
Because in his book, doesn't he have that? Or I guess
I'm
I've
pretty sure he
seen your
does.
illustrations.
like
Do you-
that.
Oh, yeah, okay. Yeah.
Inga
Oh.
does that too.
Do you do it that?
Sometimes I do that, sometimes I do it the other way, depending on how mobile the person is. If you get some, you have good mobility in your joints, in your arms anyway, you know. But sometimes you get people with arthritic fingers, and you've got to be more careful you can.
I think that's a good point right there, that if you're doing a routine, and you're going through and you don't have a problem, probably for efficiency standpoint, what you were just doing there,
Yeah.
which I don't really do, so I'd have to play with it to actually, remember the feel of it.
Yeah.
It's probably
I do it both ways, like she's doing it now,
Yeah.
I'm doing it the other way
You
too.
do okay?
That way
Yeah.
is a little more specific.
You can-
You have more
The
control.
thing is, you can feel what's going on in the joint.
Exactly.
And that would depend on how much work you do and how much of this kind of movement. If there's stiffness there and you want to work it out, then you can work longer on it.
Likely.
Yeah, and you can also massage in here and loosen up some of those other muscles in here. We didn't do any of that in between the channels of the bones there. So I think that's important too. And also, I work on the palm. Well, that's
Yeah, so there are a
something.
lot of fun.
Oh,
Well, yeah.
that didn't.
Forearm twist where the proper way that you would hold your hands. Some people hold down here and twist here, and some hold a little higher up, twist this way.
Yeah, that's a good ask.
So I was wondering.
What's everybody's comment on
I'll show you the way I did it yesterday, the way I do it. I don't know, I assume it's the same way I hold it out like that, twist it like that, let it go back. And I'm holding this so this doesn't move at all, really. I'm just
Right.
twisting the two bones there like that and go back. Okay. Is that anything you remember or not?
Right.
I would like to know whether, over a period of time, I found myself when I was turning the hand this way, I was also turning in the opposite direction at the elbow.
That's probably a good idea.
I felt was twice as effective once more.
I agree.
And here, and as much as I can do this, in other areas of the body, I do it. I think it feels
But
more
Yes.
complete.
Yeah, definitely. Yeah, again, it's a matter of, how smoothly you can do it. You don't have to change, so you can do that without really significantly changing the position of this hand. So as long as it's
Yeah.
smooth is the key to it. If it's awkward.
And also notice Harold spontaneously used the outside hand to hold the elbow while the others were using the inside. I don't think it makes much difference, as long as you can do
The
it
reason
effectively.
I put the hand on the outside of my body and he had it on the inside. That's the difference.
Because I do it like this.
Yeah, I did it on the outside.
But we kind of go from where we,
Holding
Yeah, the only
holding
reason we
Where
do
we-
it on the inside is the inside hand's already there.
Right. That's
If
why-
you're doing the routine, yes, the inside hand is the one. I was
Mhm.
doing it just specifically
So-
doing that motion just because that's my right hand. I tend to be right-handed, but you're correct. If you're-
Again,
it's just because we're there.
those are the kind of details
Well, that does
Right.
make a difference because of doing the whole thing. See, if you're doing it this way, ideally you would use your outside hand there. You'd have this hand there because then you can go into this.
Right.
And from there, you can go directly into this.
Mm-hmm.
And then you cover the whole thing. And so that's why it does make a difference.
Yeah, it's important, I think, for one move to flow into the next, so
Exactly.
that there's no pause. It's not like you're standing there thinking, what am I gonna do next?
Right.
You just,
And also time-wise,
yeah,
because
and for efficiency.
because essentially he had things worked out to be able to do a very complete treatment in 45 minutes.
So speed and coordination, what you do before and what you do after makes some difference.
Make a big difference.
Yeah, right. And I do it on the outside because what I do is a sequencing leads into that
Exactly.
and leads out of it.
Yeah.
But, you showed it a different way and it still led into it and led out of it. So I don't think again, it has to do with the coordination and what's efficient and effective.
So I guess that was the next thing, was the question about the shoulder. And you were
The
holding it.
Shoulder, yes.
Whether we're in
If we do the
stance
archer or the horse,
stance.
that would be good to go over.
So it was.
And there are a lot of variations on that you see people doing depending on when they were trained by Dr. Reilly and at the school. I've
Well,
seen a lot
Harold did
of
it just
different
about the
things.
same way I
Yeah.
do it myself and the way I remember it.
It's,
Except for that, I don't do that. I don't do that for some reason, I forgot it, I guess. I don't know if that's in the book either.
School teaches
Yeah,
it, most
but-
everybody.
Yeah.
It's just like you, they leave it out as soon as they're out of school because
Right.
they do a lot of this range. The elbow flexion.
It's in the book.
I think that.
But it's in the book when you just raise your arm up, about there in the book. Because I did the illustration on it, that's how it goes.
Well,
Not even go all the way like that. It's more effective, I'm sure, if you can go always like that. Because
what
that,
he
that's
what he
nothing
did was
there.
always taking the idea of any of these joint movements was to go to the end of the range of motion
Point.
and then feel the nature of the, what the end of the motion was, whether there's a restriction there, whether that's normal. And so it's actually, besides being therapeutic, is also diagnostic, although of course
Well, that's why
massage
I think
therapists
it's
aren't supposed to
important
be
because
diagnostic.
it tells you how the condition of the joint is.
Exactly.
Right.
And so being in this position, then you can just very easily move into these rotations, which were somewhat increasing. And see, it's starting out again, and it's partly diagnostic. Starting with a smaller circle, you find out, okay, is there a restriction? Because if you got a restriction here, well, then you'd be in trouble if you would have started going like this. The person would have,
Let's start big.
Okay, you can. I mean, once you have a good feel of it, but in terms of learning, probably starting a little bit smaller would be good because then you get a feel, if there's a restriction up here, then you know not to push
Right.
too hard.
It's the important part of that stroke you're just doing, that movement you're just doing to work in this upper region, to do the stretching back up in this area. Because that's what it looks like, the importance of that is.
You're
With the way you were
pulling
doing it
down,
yesterday
right?
too, right? The arm, taking the arm up high above the shoulders to stretch and.
Yeah, well,
loosen it
because
and so
this
forth.
you've already been in this position,
Right.
so there isn't too much there. So yeah, but it's also anterior, but also I have traction on the shoulder at the same time as I'm doing this.
And when he taught later, I know he had changed that by the time he taught me as to how you hold that. I don't know if he taught around that way, probably. But it was like this.
I learned like Harold's.
I know, but he taught me this.
Oh,
And another student that I know also was taught this.
wow. How did he teach you, Alvin?
That way.
Oh, he did change
Yeah,
that.
he changed that. Now, it could be because he
He pulls
felt like
it
that
out.
was too much.
Stretch his arm, the
The
shoulder.
traction
looks
is
like-
here, right? And it was
Okay.
action from the hips.
Interesting.
Yeah,
The new and
Person on the
revised
table
edition.
might have needed more traction out there.
Right,
It does something a little different.
and that's totally different from the way we teach it.
You're holding where at the biceps, right?
Right.
That's what I do.
That's the way Ray does it.
I feel like I get a little more
Yeah, that's-
there,
Yeah.
but I feel like you get a
I think
nice
he toned down
flow.
what he taught people sometimes, a little bit later too. And this is a little bit more of a toned down thing, but the guy he taught before me, which I got it from first before he trained me, is now a physical therapist in Germany, in a family business. So he would have known that this boy was going to be going into that, would probably have taught him what he thought was effective.
So how, the way we teach, we walk up the arm.
We have the arm.
That's for
Right.
the shoulder.
For the
tucking
shoulder,
in.
right.
Next one.
I'm just trying to feel what the differences are in there. Of course, one of the main differences is whether you got the elbow involved in the process or not. This one is a little more complex in that I think that you don't have quite the control over the shoulder that you do with this.
I feel
See, I can do this range of motion
Mm-hmm.
and feel the joint better than I can with this. I'm out at a longer lever, and so I can't feel that, I don't have as good control over the shoulder joint.
So I think for general training of people who didn't
Right.
have any background in body work, probably he changed that to simplify it, as opposed to what you were doing, which is more physical therapy.
And so anyway, so that, if you're like this, then, and you've completed this motion, then this goes up underneath here.
Right.
This comes down to control the joint. And then you've got the shoulder joint in your hands, and here is not going to do it.
So you
Gotta-
hold the bottom hand is pretty much in the armpit.
Yeah, definitely, right? You see, if you're down here, it just isn't gonna work, and you can really feel the difference in terms of, the person getting it.
yeah, big difference.
See, there's a couple of things. One is you've got complete control over the joint here, whereas here you don't. But also here, in order to get enough traction to really do something effective, if you've got a good stable joint, you're gonna have to push here, and that's not comfortable to the person to be pushing here. Because then you've got the nerves and arteries and veins and all underneath here, and you've got more pressure there. Whereas if you're in the armpit, although you might at first think, oh, well, pushing up on the armpit, it's going to be a problem, but actually it's a more natural place, and you've got all the muscles crossing over there and everything, so it's more protected here than here.
Mm-hmm.
And so here, see, I can put quite a lot of tension on it without good control.
Okay. Okay, now when you do that, do you use the archer stance or the horse?
Well, see, the whole thing has been a fluid kind of a move.
Right,
And so,
and you're in the archer. Okay.
yes, whereas, see, if I'm here,
And that's another one that we teach when we use the horse stance. You're
I'm
facing
gonna
the
be here,
table.
I'm
I
not gonna-
never have. I always did it from the fencers.
see,
Right,
from this
fencing.
from this
Well, not we, but I
position,
mean some people. That was a question. That's
from
what I
this,
meant.
you don't have the flexibility, and to see, in order to move the arm here, you're going to have to move. So it's going to take a lot more motion on your part as compared with if you're here.
Yeah.
I think that was a question James had, Dwight. That was
use
it.
your body
Joan, you had that. You and
James
James
had
To
did.
learn.
get traction and not jam
Okay.
the shoulders. That's
Th-
why
that's
they
what I
came out and
thought,
pulled
yeah.
it out this way and did it this way so that they would be sure the students wouldn't jam.
That's
Okay.
because we're
Well-
doing the previous rotation differently.
Well, that's my one question I wanted to
Because
ask
what
Harold.
we're teaching, what you're doing here, think about this. We've been into this position with them and worked and come down.
Yeah.
And then we're going into the rotation like
I think that if you are,
rather than the other
I
way.
think that if you're up here doing that, it would be
Then it would
a
be
natural
natural to go into
possibility
the-
to be doing
Yeah,
from here.
that's the difference.
And I do agree that it is a problem that a lot of students have, that if they're here, they have a tendency when they come up to push up and not to
Into it.
maintain traction, because generally speaking, throughout all the rest of the massage, one of the points that that I notice is it's important not to be doing a lot of twisting motion and trying to push sideways, because that's hard on your low back. And so actually doing this motion like this does violate that rule, in that I'm having to put my, in order to get traction, I'm having to pull sideways. And so from a biomechanics standpoint, there is some advantage to being out like this. Then you're not violating that rule of
That's
pushing
better than what I was doing.
sideways.
Because I get real close to the body. I'm doing what you said not to do. Pushing straight up like this.
So you gotta, because that's the one thing, all the muscles, again, always push the joint together, and the one thing that you can do that they can't do for themselves is traction on the joint.
Good. I'd like to copy that too.
And I don't know why I do it this way, because I think it really is uncomfortable for me to do it on the archer
Right.
stance.
Any other? Do
No,
you
I
have
think-
your,
I think-
your,
Yeah, pretty much do it. When you were talking about pulling the muscles out, there's another movement you can do by just putting your arm in here and then pulling out like that. It's
That
just
feels nice.
it's just another move.
Leverage the-
Cupping it so that you're not pushing on the artery.
Yeah.
Then let's see how you move the joint.
I think that was a
yeah, let's just kind of do the whole
just
little
it
routine.
pulls it out. You see.
But do you move it, rotate it, or do you
Well,
just stretch it?
not that was just pulling it out
Just
here.
so
Then the other was what Harold was doing here.
Yeah, if you could just
Picking it up.
back up a little bit and kind of run through your approach of how you do the wrist, elbow, and the shoulder maybe. And just see that
Well, the
variation.
fingers were just the wrist, the rotation. And a lot depends on whether the person needs it. I always flex the elbow because I think it's important. And again, you can do more work on massaging around the elbow if there's any problem there. And then I don't do that other rotation. I just go into this, and this is.
So it's something different again, working on
Right.
different muscles.
Mm-hmm.
So I
And
think there are lots of things you
I
can do to
a lot
the
of work
shoulder that's
in the
effective.
neck too before that, because, and you haven't had any work done in your neck.
I haven't
So,
seen you in a while.
Yeah, no, I mean now,
No,
it's
yeah.
just so that all this area is loosened up before I start on the rotations. But that one, and I can't remember, that was one that Dr. Reilly showed me for, it was for a specific purpose. And this is, some of these things, but it's a nice move. I like it. I like to have people do it on me because it pulls, when you're doing massage, you're always pushing in, and this pulls it out.
Okay, good.
Nerve compression.
Pretty much the way you do it.
Well,
Did Ray have anything different, so we can get that on film, or?
we got yours.
Pardon me?
We got your shoulder.
Mine's a little bit different, and yours is more effective. I don't think you want mine on there. I don't think you want your students to see me. I'll show you anyway. It was more like,
Yeah, I'm putting you on, Ray.
it's more like this. It doesn't stretch the shoulder out like you were doing, so.
Right.
There, the one you were doing is evidently much
Hand
better.
closer.
Yours is evidently much better than mine, so I have to remember yours.
So the nerve compression was having just finished this, then it's natural to just
Squeeze in.
that, which is, the idea of it is to have compression all the way around, okay?
Yep.
Not just on one side, and so you have to get your hands all the way around, and so it's both in and also up. And so by having your hand in here, see, I've got something to push against. Whereas if the hand is just, if it's just flat, then, in order to push, I'm gonna have to jam her shoulder.
And you missed the under part of the arm too.
Right. But even if I had it, I don't have anything to hold her hand down with.
Right.
So having the arm tucked here that allows you to push up. See, I'm actually pulling down on her. I'm pulling down on her hand as I'm doing this.
And the point of that is to sedate the nerves, nerve compression.
Well, it's my speculation. He never told me this is why.
I think
He said
Joe
you do
Dudley
it.
talked about that in his book. use that
It was in the
term
Kellogg
before he
book.
did his
Right.
research.
So-
Normalizes circulation.
Yeah, I mean, it's like I say, it also certainly is another very effective lymphatic technique. You know, the compression and the pushing out. I mean, that
Probably
is-
does a lot of different things.
Yeah.
The first massage I ever got was from you,
If it's
at
called
ARE,
nerve
you know,
compression.
down here. And you did the nerve compression, which nobody else ever did since, which was one of the best moves I ever felt. And it was that compression the way you do it.
Yeah, it certainly feels great, regardless of what the mechanics of it.
There was a change that occurred in the way the school taught it a few years ago, mainly based on the way it felt, and that's why it's different in the way it's taught in the first semester.
Doing it on the
from
table?
Right.
Yeah.
We'll
The
start
fact
doing
that I
it.
remember the faculty meeting particularly where that was discussed and where it was changed to more of
Laying
this,
it back down.
which is not nerve compression, as we
No, it's
talked
not.
about.
Pulling.
Yeah, right, it's this. You could add that in, I suppose. But this is the way.
Do you know why it was changed?
Because of the way it felt, some people felt that this was too abrupt and the students weren't doing it well, and it felt like they were grabbing.
I think it's one thing leads to
Okay.
another, and we started out with the fact that you didn't have the hand up like this because then the AMTA said you got 3-point contact and that's illegal. So then you got to put on the table. Once you got the arm on the table, then you can't get the traction. So then this doesn't feel so good. So then, you know, it's like a
Right.
domino thing, and you lose the effectiveness of the whole move.
What's this 3-point contact illegal?
Yeah.
Is it-
I mean,
never heard-
illegal in
I never-
quotes, I don't mean,
To
you
be
know, I didn't
avoided.
mean that, yeah. That
They
They
recommend.
counted off if you were doing a practical demonstration for AMTA, and this was concerning, I don't know, I guess, you know, maintaining your professionalism and not having, you know, their hands or their body parts touching your other body parts.
It's one of those rules that became a rule and people forgot why. You know, I mean, that was, it's
Yeah.
entirely appropriate to do it that way.
Well, what is it?
Later it was just called 3-point.
Demonstrate what it is, 'cause I don't know.
Well, just anything,
Okay.
you have one hand, you have another hand, that's it. You're not allowed to touch anywhere else.
Oh, so you couldn't put the arm on there?
No.
Oh.
No.
Yeah, I think a lot of it had to do with avoiding, because, you know, if you have a large client, if you lean into the table, you're making contact, even in your genital area, against them.
Yeah, up there, it's like
So
if
that's
you're
that's
a woman,
inappropriate
I was gonna say, if you're a
contact.
big busted female and you
And I'm a
tuck someone's
guy.
arm in there,
No.
you've got AMTA.
So that's what.
So, in any event, that was a large part of the discussion around, you know, whether you should hold the arm up or not.
Well, will we have to change that once we're AMTA certified? I mean, that won't matter,
Maybe we do away with the
AMTAs do some
AMTA.
in their
are
guidelines.
they? Okay.
Realistic.
But I think we ought to go back to doing the nerve compression the way it's being demonstrated.
feels great,
How did you do the lower
because I
arm?
do the pulling.
Lower arm, well, okay,
Joe, that's how
having gotten to the elbow, see, then you can rest the elbow there and then push into the table.
Yeah. The way I,
It's
it's harder to
the way I
learn.
sort of evolved to do it.
Once you learn it, it's just as easy as the other way.
Yeah.
The way I sort of evolved into doing it was like this, it's the arm is right there. You just move it around like this and like this.
Right.
That feels
There are
good too.
variations on
Yeah.
that.
And it's sort of-
Yeah.
And then for the body mechanics, when we teach that, because you were leaning your weight into it, but you were basically standing,
Now, the only thing about this,
because you're using your upper.
you still eventually have to get the arm down here. See, doing it this way, after you finish off here, then you've
Right.
got this hand here, this hand here, and then you can do this final stroke. Right? One that side, one that
You got to
side,
go right into
and you're done. Okay, so it's a very smooth flow, you know, from here
Right.
to doing that, and you're done. And right at that moment, the finishing off part of it, you know, if you can do that as smooth as possible, it gives a much better, you know, relaxing effect if that's your objective.
And I'd been teaching it the second semester because of the nerve compression, I think, being important the way it was, but I was trying to incorporate it also with what was being done in the first semester, so as not to step on anybody's toes. And so what I was doing with the students in the second semester was the nerve compression and then putting that stroke in that they were being taught, which I don't know if is appropriate or not to do the sliding off.
Like a nerve
But
compression.
that might prevent some of the grabbing feeling that was the complaint originally, that stopped doing this to begin with, because some students can go, and that doesn't feel good.
No.
Well, yeah, and of course, that's one of the problems when you have, you know, a few teachers teaching a large number, whereas with Riley, you know, you worked on him, and if you did that once, that was the last time you did that particular move, you know, it was corrected.
If you didn't like it, whatever it was.
Yeah. So, you know, you didn't have a chance to develop bad habits.
Yeah.
Let's go to the abdomen, please.
Okay.
Ray, do you want to show what you did at the beginning with the...
Yeah, that was a interesting move there.
I'm gonna go sideways here, you
that
think?
was one of the newer.
I was just realizing I
You see the
couldn't,
work on
not
the
really, I'm gonna be
white
right in your
tail,
way.
best I could tell. You know,
This is the best I remember this movement. I don't know what you think I would have.
you do.
I just put the hand over like this,
He just grabs
Like
the
that.
navel and
and do kind of a waving motion with the pressure from here, moving around like that.
This kind Francis, don't you teach that similar
I
in
suppose
advance?
that's-
And then you're
is that the
over- then you
lacteal
start
duct
over here like
that
this.
he's worked on
Okay.
that by doing that, or what?
I don't know, you know, I
Do
mean,
you do that, Ingrid?
I know the feel
Do you
of
do
it.
that
It
move?
felt really
so
good when it was
forth,
done
but
on me.
Similar
yeah.
to that, not exactly like that.
Yeah. Yeah,
That's pretty much the
pretty-
way I remember it.
Yeah, yeah, that's, yeah, you do that. There are a whole lot of different things. Of course, one is, you know, how you're gonna get started, so as not to startle the person. And so you do have to, not be in motion, not come gliding in, but, have a definite contact before you get started. And, what Ray was doing, a couple of different, possible ways of starting. But after doing some general motion like that, and kind of spreading the, usually if you're working with oil, then you got to kind of spread, the oil out some too. And then getting into the specifics, and that would be starting at the end of the colon and working way back with the idea that, again, what we're talking about, like the lymphatics in the arm, that your each individual motion is going to be, the normal flow of peristalsis is like this. But you don't want to start here, because let's say you did move something from here to here, then you'd have twice as much to move from there to there and so forth, so it would tend to block up. So you're going to start here and you move this to there, and then you're going to move this to there, and you're going to move this to there, and so forth. And the other thing that you have to remember is that where the large intestine is down in here, okay? And so if you are thinking that you're going to get at the colon by working from the front of the abdomen, you're going to miss it. Pardon me for my long fingernails. So those of you, anybody's looking at the videotape, these fingernails are much too long to be doing what I'm doing.
Really?
So, in any event, coming in, getting at that large intestine, you can't get at the flexure up here. You just get as close to it as you can, because it's underneath the ribs.
A lot depends on the age of the person too, when you're working on the transverse colon, because it tends to collapse.
Exactly. Yeah, and it's you always on anybody. You're always going to come down. And I'd say, if you had to come up with some sort of a general rule, you're going to come pretty close to the umbilicus. So up here, you're going to be on the stomach, and that's not only uncomfortable, but you can also potentially aggravate a hiatal hernia, problems like that. So you're always going to come down as you come across.
So then you can work the transverse when someone has a hiatal hernia. You just have to know that you're in the right place.
Exactly.
Okay.
And also, with each section, after completing, like say, after I finished coming up here, then there was kind of a vibrating kind of move. Now when I have oil on, it's easier to do. So now the skin moves along, so I can't do it. If I'm going to do it now, what I have to do is do it with one hand and hold the skin back with that, but this isn't the way I would do it with
Do you want oil? Do we have oil?
Yeah, it's right here. Well,
Is that okay on the whole?
so you vibrate as you do each section,
Okay.
because
Yeah,
we
and then-
vibrate
the whole thing.
the whole
absolutely.
thing.
Well, both.
Beth,
But the
Yeah.
main
Careful your
thing
finger,
that he
the
taught
top
there that we
finger.
want to change
There you go.
is we
No, it
take
didn't
3
show up on here,
paths
but thank
coming
you.
down lower each time,
Mhm.
getting to the
I
umbilicus.
didn't know if it
Most
was-
That's
people,
okay, thanks.
you just have room for one pass close to the navel.
Right.
Nobody's transverse colon is that high, except babies maybe.
I'll check.
And
Check
again,
down
see,
the-
if you come down across here, you're missing the colon, which is
Right.
back there. So you have to work your way out to the side some.
And you're pushing up
You know, each move is up. It's
Right,
circles,
yeah, right.
circles with the move being
Right.
up, and then just the rest of it for
To get back.
smoothness and to get back. Still probably need a little more oil in here. Yep, so that kind of a move.
So then you're not doing any pass at all at this level?
In terms of this move, just doing the call, and then having completed that, then, you know, then you do some, you know, some work all around, more or less in a clockwise direction, and a move like, you know, like Ray was doing.
Oh, we shouldn't go much further.
Because I have learned to do a pass here, a pass
Well, no, you can work.
here, and a
Yeah,
pass
it's good to work
below.
down there. Yeah.
Okay.
You know, of course, you know, if a person has a full bladder. It could
You
be
don't want a vibrator
uncomfortable.
on them, huh?
But no, there's no, you know, no reason not to work on that.
I remember Dr. Reilly saying whenever he was training me that you could easily spend a half hour working on the abdomen, on the colon, to good effect, if you had time to do it with anybody.
You know, there's a lot to be done on a colon because, you know, think of what all's going on in there. Most people are, you know, a lot of toxins and look at the importance of the colonics and stuff.
Stimulate the liver at this point, or do
Yeah.
that for a minute?
Right.
Yeah,
Part of it.
yeah,
Mhm,
yeah,
mhm.
you know, that too. So some other
And
people.
would you do that?
Do you want,
Oh,
or
Show
should we
them-
show them the way we do
show
it
the
to
whole
make sure
routine.
it's right?
Show you the whole routine.
Yeah.
I mean, a few
Show the
people
full,
on the
full,
abdomen.
full, and the C stroke.
Yeah, show the whole thing that we teach Dwight to
Well,
see
let
if,
me take my,
Start at the hip, and just hold like this. Sorry for the ring.
Oh, no, that's fine.
And then we do a C stroke, where again, we're leaning over the table, but you're trying to keep your back tight. And from here, you just move right in to the twist.
and before that is when we vibrate the organs, before he did the
Oh,
pulse.
I'm sorry.
Yeah.
Yeah, start out there, the cocktail shake.
You know, he taught it both ways, vibrating and shaking. He said some people can't vibrate, so you just shake.
Okay.
Heavy people especially.
So that's, and then we end with a butterfly
And
stroke.
this is what Ray showed us too.
Right,
Exact
that's how
same
we-
thing. Hooking underneath it.
And then come up.
And then it sort of lift the rib cage.
Do any of you who are trained by Reilly know if he taught using the right or left hand over and under in any specific way or both ways? You know, I was doing it like this, facing this direction. At the school, the change was made like this so that you could face the client.
Yeah, I
And they
think
do it
that's
like
probably
this.
the way I
But,
do it.
but this is the way
There,
he
your
taught
arm
it.
is against the breast.
Well, it wouldn't have to be. I was doing that on
choice.
purpose.
You want to show us the way you do it?
Part of why we teach it the other way is so that you can see, comfortably see their face. So if you're putting too much pressure, you can see if there's discomfort.
Right. There we go.
You know, I can't even remember. I do it this way, and I,
Like that, yeah.
yeah,
I think
I
that's-
believe this is the way that I was
That's what
taught to do it.
Is it?
Yeah.
How you do this side over here, explain it.
Well, that's an interesting question, and sometimes he would say to do it, sometimes he'd say not to do it.
The vibrating motion.
Yeah, from time to time, as far as whether he thought, because the spleen is potentially delicate, and some people, like if you happen to work on somebody with mono or something, you could potentially rupture a spleen doing that.
Well, also, if you were doing a lot of lymph drainage, you probably want to work on the spleen.
Yeah, so it's a good idea.
It's so much of this is individual, you know, how much detail work you do is.
We do recommend to the students when we do the spleen to do it lighter, not to shake us.
Right. And that
That's
would be-
even on
that
the
would be
instruction
appropriate.
sheet.
Yeah. The other thing is with the doing these things.
The pulse.
You can get more effectiveness out of, as you're coming up with the one hand to go down with the other, then you got, some, you know,
Yeah, it's sort of a push-pull
yeah.
motion.
And that
Like
way,
we use on the back.
that way you can use your back to do the work. rather than the arms. And so whereas this, I don't think feels as good to the client either.
That feels more.
Whereas this, you're really getting in deep and you're really working the muscles. And actually it doesn't take much work because I'm just twisting is all I'm doing.
Okay. Any questions or comments on the abdomen?
Inga, did you do something different on the abdomen?
I don't know.
Without thinking about it, just do an
Just do
abdomen.
it, yeah.
That's right. As if none of us were here, except for Terry.
Secretary.
And we've been there before.
Terry,
And then
wait.
I
I guess I usually start out with just lifting the rib cage and pulling up. And then this is kind of, Dr. Reilly used to say, draining the kidneys. I'm not sure what it really does or not. And I usually do that 3 times.
Yes, good.
All the way
I
around
think
the
it does
back
have
till
an
your
effect
fingers
with your
almost
fingers.
meet.
You
And
keep
then
your
just
fingers up in there.
put pressure on the ends of your fingers over the kidneys and pull down. And it always feels good when somebody does it.
Mm-hmm.
It's very effective.
I see, that's what we show at the end of it, and you start with this.
Right.
You start
And
with
I
this 3
start with
times,
that,
okay.
yeah, and then I just move right from there into this, what you were doing, pushing and pulling, and that looked good. And I generally work down over the hip a little more too. And that's what you call this, the C-stroke. Strokes. And then I usually do the liver, here,
Mm-hmm.
either vibrating or shaking, whichever. And then, I guess go into the colon. But you do it like this.
You just use the heel of your hand.
I use
In different
both
ways.
my fingertips and the heel of my hand. And I usually go part way up and then come down and vibrate. And this is what Harold
I was
was
just trying
vibrating, but he
to
was
get it
doing
on top.
You know,
That feels very comfortable.
yeah, everybody has their own,
Yeah, there are lots of ways of doing
their
it, as
own
long as
way,
you keep in
you
mind what you're trying to
know.
accomplish.
But it's just a matter of working. And so then just some days vibrating is easier than other days.
I don't know how much coffee you've had in the morning.
I know.
Some days you have good vibration.
Ah, yes.
I think what Francis said is really the key to teaching the massage is what are the principles, and what do you want to accomplish?
I guess this is just easier for me now.
With the heel.
And then doing the rest of the way.
Well, I think both moves are good and they're both different.
Yeah.
And I think that's also a good general rule on a lot of things. You get in specifically with your fingertips, but if you do too much of that, it's uncomfortable. And then using the heel of the hand is a more of a broad,
And
compressive kind of move, and it feels relaxing.
he said this was good for working on the small intestine. Just sort of, sometimes he'd say just pick them up and, you know, and let them down. So that move is good.
Quite a bit of that I
And,
teach in the second semester, based
and,
on what they do in the
this
first
is a move-
semester.
I think I learned this from Betty Billings. I'm not sure. You just hold your hands like that, and then it's just a vibrating. And you're pushing up with the left hand and down with the right, so that you're just. And it's a nice move.
I don't think I ever saw that one.
Yeah.
It feels very.
It's just like this. You just
It's like with
your
fingering
hands face
feet.
each other.
You're pushing away from
And
each other.
then you're pushing up this way with this hand and down this way with this hand. And you're using a vibration. And just circle around.
That's somewhat very similar to the water move on the abdomen.
Looked
very
familiar.
Well, I mean, the concept is, it's different in the way it's done, but it's very similar to what they're trying to do.
Inga, how about
Excuse
the
me,
other,
may I
other
go to the
side?
bathroom?
This side, yeah.
Do you go right to the other side to do that?
Well, when I'm working on this leg, then I might do this, but I don't usually vibrate the spleen unless I'm doing a lot of work on the lymphatic system.
But you did this sort of push-pull on that side.
Right,
and not
on that side. And I would do that when I get over. When I get over here, I can
Okay.
lean over, because it's easier for me to do it opposite sides. Now, if I were going to do the spleen, I'd probably do it like this, and just give it a little gentle.
From the same side? Or
I do it from the same side, yeah.
But you go over and then do the opposite. the push
Yeah, I do this area from the opposite side, like I did that.
When you finish the stomach, like you just have done, then
Right.
you would go over
Then
there
just,
and finish.
just
and do that.
from there, where would I go? Probably down the legs, because I've already done that.
How about if we move to the neck, face, and scalp?
Yeah.
Yeah.
Oh, no, I'm
Okay.
fine. Thank
You want me to do it while you do?
I didn't eat a big lunch
Go ahead,
or
Joan.
breakfast this morning.
Who's gonna, Dwight?
Is the hair out of the way?
Again, we offer them a towel if they want it, but my hands are dry.
And that doesn't
And now, it's not exactly how you do it, however, we are trying to move the underlying tissue and just cover the entire scalp.
Is that the first thing you do when you start on the head?
Lighter over the temples, but just trying to make sure that we're hitting coronal, sagittal sutures really well.
Mm-hmm.
Well, actually, that brings up a point in terms of sequencing.
Legs before.
Which was, Riley always did legs first, and then
Yep, Ray
Okay.
changed for the same reason that the school changed, as I understand. Believe me, I'm getting this all secondhand.
Right.
People had smelly, sandy feet,
Mhm.
and nobody wanted to go work
Right.
on their faces after
Right. Yeah.
after that.
That's
Yeah,
why I changed that sequence, because I work on people's feet, and they said, I don't want you to touch my face
Right,
after you
right.
work on my feet.
Yeah.
And then after that, I did
I think for those reasons
makes
it mostly does work out. I know that Riley kept a container of alcohol around, and if somebody had that complaint, he would just use the alcohol, clean off, and then go there. So he seemed to have the conviction that that was the sequence to do it in, but,
Do you have any understanding of why he did it that way?
Sure.
What his thoughts or principles were behind
Well,
it?
I've heard him say that sometimes if people are very toxic, they might get a headache, or if they have a tendency to migraines. And so you want to work on the head afterwards so that you can get rid of it.
That's in his book too, that he
Yes.
Right.
that he always wanted to work the abdomen before he worked on the head, because if he gave them a headache from working on their abdomen, he wanted to be able to go up there, change it around. Okay. But the scalp, Ray, and do you remember this coming from Riley? I mean, you did something.
No, I don't think that did. That was my own
Okay.
addition.
Okay.
I mean, it's nice, good stuff.
and as I remember, do the neck and shoulders first, and then end up on the head
Right.
last.
That's the way he
Scalp
actually taught.
would be the
Yeah,
end.
that's what I do too.
Wow.
Again, it comes down to a matter of, what's the situation with the oil and so forth, because, if you just clean your hands off or whatever, then it would be, if you don't want an oily head, then it's good to start with the scalp, but on the other hand, working the scalp is kind of more relaxing and makes a good finish to working with the head. So there's considerations in both directions.
I agree, I guess when I do it, I usually would finish with it too.
Yeah, I work on the neck and shoulders, or the shoulders and then the neck and then the face, and
Right.
finish it.
Right.
Okay.
Okay. Geez, now I gotta remember. What do we do? Just what do we teach?
Yeah.
Because I know I don't do it
I
the way we
reinforce
teach
it every
it.
week as I teach it.
Show the first semester, Nick.
We start flat here.
Right.
And just do our effleurage like this.
Mhm. Wish I did do it out again. Yep.
Is that okay, Terry?
Mm-hmm, it's great.
Just keep it like that.
And then after we've effleuraged, we do our little circles, finger circular friction down the lamina groove with the transverse processes.
You're saying down, are you working down or working up?
Mhm.
I start at like C1 and come down. But granted, a lot of people like to work up.
Well, Ray showed us yesterday, starting low and working upward, which is what I would call.
But the
Yeah.
pressure is still
The
down.
pressure is still,
Pressure's down.
is proper for the lamina groove.
Hmm.
Yeah, and again, that's the same thing everywhere on the body, arms, legs, so forth. You're working, although your movements are towards the heart, you start proximal and work distal, again, because of the lymphatics and so forth.
So we would start C1 and move down.
You know,
So
you
start
start
C7 and move
seven
down.
and
Seven,
you
yeah.
start
I
at
was-
7 and then you'd back off towards C1 with each of your movements being towards the heart.
Okay, it's the old principle, the tube is full here, so you clear it so you can move.
Okay, so I guess I'm going.
So that's
In
right,
school,
right,
we were
yeah.
taught from the top
That's right.
to the occiput down, and sitting down and making the movements down the neck.
But again, I
That was
guess I
5 years
usually gave
ago.
them the option of going down, coming back up.
Yeah, I mean, if you're going to spend some time, then you might end up doing them in both directions. But the primary one would be, if
Start
you,
at C7.
yeah, particularly
Mhm.
if you were trying to keep the time
Okay.
short, and what
Yep.
way are you going to do it? If you're only going to do it one or two
Once.
times,
Okay.
then you should start at
Okay.
7 and
So
work.
we'll start at C7 and work to C1.
So we need to change that.
Okay, after that, of course, we cup the head.
I'll have to get on this side. Should I go around?
No, just stay there.
Okay.
And finger friction, pressure down, coming from the occipital ridge down the trapezius, glide back up.
Can I go over here?
And the pressure goes down.
Friction
So
down.
you release the pressure on the
You yesterday when you showed this,
See.
we do this with the fingers first, then we do a knuckle kind of press.
Mm-hmm.
Well, more what I was doing was trying to drain the lymph, and I was starting
Right.
down here, small circulation.
Right, if we have time, we have them come posterior,
Mm-hmm.
further forward, anterior each time. And then the last thing we do is with the thumb. And again, if we make 3 passes, and generally we tell them make 3 different paths, each a little more anterior as you come.
Right.
If you have, if you time, you've got 3 passes, this is, if you find something, then you got a new game. Okay? And then we
You
just
teach
roll
a
to the-
45-minute massage?
Oh no, with everything we put in, it's about a 55 to 60 minute massage, and if you put everything in, it can be up to 70 minutes long.
Because we learned 45 minutes, but I do
Wow.
an hour massage.
Yeah.
Okay. I won't repeat the other side.
Well, did somebody else want to show
Yeah.
their stuff?
Somebody want to?
Not that I don't.
You do it that way.
Did
You
we
do
get
it-
Ray on film
I'm interested in what
yesterday?
Inga would do.
No.
You wanna,
Well, I just do a lot of, I don't
I can go on the other
quite
side, can I go on the other side?
I just develop my
Is
own
this for the?
style, and it's hard to
Of the neck, start the neck and the head. Just the beginning of the head. You start the neck, how do you start the neck?
I sit down, for one thing.
Oh,
We all sit down, Ray.
And I usually start just by stretching a little bit here. Just and then I guess I didn't do what you did. Start.
talking to someone last week I met at the Heritage Store who was in one of Riley's workshops. And she said, you never work other than from the head down to the shoulder. Never, never, never. You stress that all the time. I didn't want to argue with her. But, you know, what we've been doing today is to work
Up from the shoulders, up to the head.
shoulder up, right. I think she was getting confused because of
Exactly.
her lack of anatomical background with the idea of vascular work.
Yeah, because it's where you'd say all the movements are in that direction. and
Right.
People sometimes,
Right.
in retrospect,
She was being
would.
very literal with that.
I use my knuckles in here because it's,
Mhm.
I can get in a lot
Mhm.
deeper.
And
Yeah.
scaling is particularly.
Yeah.
That's like cross fiber.
Yeah, right.
Well, that's the way I do that too.
And then if you cradle the head, you've got control over what the head, you know, what the muscle's doing. And you feel a place like this. It's,
That talks to you.
a lot of that kind of work is you're exploring the area and to see what's going on. And then when you find something like that, then you work on it. But massage is so individual. It's individual to meet the needs of the person on the table. And then you can also use some trigger point therapy.
Mhm.
And you can always feel it release. It depends again on how much time you've got. Again, I'm leaning into this. You know, I'm not just making it hard on my hands. My hands really, my body is leaning into the hands.
So do you sit most of the time when you do it, or do you stand and sit?
I sit when I do this.
You do, okay.
Dr. Reilly always said, sit whenever you can.
Yeah, he would always have people sitting doing the neck, except for a very few parts of it. There are some moves that you have
Right,
to stand.
right.
Mhm.
You do have to stand up when you pull the neck. A lot of that, and this always feels good on me. You put your fingers together, you just put your fingers together like that, and it's right on the third cervical, which is prominent, and you just let this move out.
Isn't that the lymph drainage you
Yeah,
talked to?
it's in the readings that that drains the lymph.
Right.
It's like
Yeah,
hold-
that
hold it.
is in the readings, right.
Yep.
That's
Hold
when
it.
I started doing it, when I read that
It says
reading.
hold it for up to 3 minutes, but no more than 3
Right.
minutes.
Is it specifically at third cervical?
Third
You could even
cervical.
put your fist under there and,
You put your,
Yeah.
and
You
just
use
hold
the
it,
edge of-
apply a
use-
little,
Use something that just gently
apply a
puts
little
some pressure
pressure,
back.
you know, and that's, yeah, and there's a reading that says that's good for lymph drainage.
Mhm.
did
go
you say
21.
Viter, Francis? Did you learn that in the Viter
No.
class? No, I wondered.
Uh-uh.
if that was
Not in the first level anyway.
And all these little muscles there at the base of the skull, good to work on. The fingertips. Especially if somebody has a tendency to have headaches.
And the point there was the alternation back and forth, whereas sometimes if you're learning and getting sort of caught up in just doing one thing, you know, you could forget to balance them up.
And that from that I would go in and work on the face if somebody else wants to work.
So you do the neck,
That's what you
base,
have to
and
do.
then the scalp. You do the scalp last.
I start with the shoulders and then the neck and then I work in the face and then I do the scalp last.
You just
What
finish
you
up
do in
with-
the face?
So, well, it's just a matter of one thing I know he always stressed was never to push down on the face, always to pull up. And this is, I think he called this a beauty move.
That's where we never did that in the music department.
Pulling up. And I like to do a little work on the forehead. Some people work on the face more than others, you know, it just depends. And this again is cross, some of that cross fiber work.
We did facials last year.
But all of the work on the face is gentle because you don't want to. And you can work on the chin here if people have it, like, you know, sagging a little bit. So, and then the ears. Just take the ear between your thumb and forefinger and move around in circles all around the ear.
Did Ronnie teach you that?
Yeah.
He didn't teach
Yeah.
you.
And
What
so,
behind the
sometimes he
ears?
taught to pull the ears and then you go around the back of the ears. And around the front.
That's related a little bit to the osteopathic idea of finger surgery, pulling the
Yeah.
ears.
And then you can either move the whole scalp. He always said you got to be careful not just move the hair, you move the scalp. So you got to get a good firm grip on the scalp to do that. And then you can go in with the knuckles if you want, or the fingertips, you know, depending on just how much you want to do. Okay, and I don't know how you do this pull, but I think I learned this from Betty Billings also. You just sort of walk down the back as far as you can reach. And then turn your fingers up on either side of the spine, and then stand up and just lean back. And it just gives the whole spine a stretch. It's really nice. Feels good. All the way up. And then grab the head.
There's one Kim Berkey used.
Okay, I didn't do any of the effleurage or the stroking on the shoulders. That's part of it too. I'd like to see how other people work on the face. I guess you teach facials, don't you?
Well, we could show you that. We do that routine real quick. It's Ivan's favorite.
Yeah, I didn't do any of those stretches or rotations.
When Dr. Reilly taught this, and I did it, he said, "You don't have it, and I don't have time to go over it again."
That's that figure 8 move.
So I said, "I will get it."
And you did.
And when you keep on practicing, you get it. Now, here's your figure 8. And I'm making Tai Chi moves on this. And the victims say, "You can do this all night and all day."
Now that's a pull you're doing your fingers.
If you look at my butt, you'll see what I'm doing.
Right.
And it's coming from my waist. And it's a little disco. And he would say disco, and when he said disco, he meant disco. With my 2 middle fingers in the medulla, I'm just sitting back. Inga makes use of this principle, just using your whole body weight. If I did it standing straight like this, it wouldn't feel good.
Right.
The only thing I would add, that I haven't done yet, is the sinus areas above the eyebrow, like this. And this movement here. And then like this.
Feels good.
And then stroke out like this, and then on down like that, on down the side, like that. And then the way I would do the head pull, so as not to clamp over the ears, which to me, I just didn't like it. So I just developed kind of a new method to do it. Just anchor the fingertips in the back of the base of the skull, stand right over the person like this, and pull straight back. There's no pressure hardly at all on the jaw. It's all in the back of the head. Just come straight back like that.
What he mentions about the jaw is important because people who have TMJ problems, if you're not careful and you grab too hard on there, you can really stir them up.
Yeah, I try to avoid that, and also try to avoid the thumbs on the throat or anything like that. Try not to touch the throat at all in the front. Just try to go straight back. Just lean your weight back. Try to do it with her head level like that, not tilting up like this or anyway. Keep it horizontal. I like to do that, make sure she's still relaxed.
Did you also vibrate the thyroid?
I didn't, but it should. You showed me that. I'd forgotten all about that until I read
Just
it.
put
And
hands on either side very lightly and just, and then here is this kind of a pressure, and then either this way or just pressure, and then
I never had that in his notes. How did you do that?
Well, when one student was massaging me and he'd get to the thymus, he'd go crashing down and my whole body would tense up. I said, please don't do it that way. Please use less pressure. And needless to say, he continued to do it that way. So when I started getting clients, I did it this way, not realizing that this is a karate chop and can be deadly. And when I showed it to Dr. Reilly, he said, it's all right, but don't do it too hard.
Save it for your enemies.
Which I never would do it too hard. To me, this feels better. Does it feel better to you than this?
It feels more, it's not as vulnerable.
That's right.
Was
Did you do it closer to the sternum or all the way down to the sternum? Or what?
I do it right to the end of the bone line, the midline.
Mhm.
Yeah, that's the end of the sternum, right?
Mhm.
And here, I just make it a little broader.
His focus was again on the centers and being up here and the thyroid, and then down here was thymus. And as I recall, he had this kind of where he'd put one hand down and then tap on that hand. That'd be another way of not having as much.
have you worked the neck after doing those moves sitting down from the side, grabbing? Is that more?
Well, after pretty much what everybody was showing before in terms of doing the circles, and again being aware of getting in between the muscle layers, which is having the different 3 different. There are about 3 good places to get in there. Then the other move was if there was a lot of tightness and you really wanted to stretch that out, you need to come from this side starting up here, and you can start on the occiput. If you're coming straight across, starting up here again, you're pulling the muscle away from the spine, and then start shifting yourself down here, because here the direction of your pull has to be different. And from here you get deeper until you're down to here. Put your body weight into.
You can also turn the head into that move to loosen the muscle.
What's important is that the top hand is stationary, correct?
Yeah, so
Fairly so.
Okay.
Yeah.
So it's not, you don't want to have too much, rocking back and forth, but there could be, you might end up feeling like you're moving, just because as you're pulling down with this hand, in order to keep the head from turning, you're going to have to push it up a little bit this way, but the objective is not to be rocking the head, but to be more stabilizing it. And it's like the whole discussion of with the arm, you're going to just hold this still when you do this, or you're going to be, as you turn this way, you turn a little that way, and the net result is it doesn't really, although you're pushing the head that way so you can pull into it, it's not that you're intending to have your head turn. It's very slightly. And then you could, if you feel that you want to work more laterally, then you could turn the head a little more to get into the lateral muscles. So if the head isn't turned, then you're going to be sliding right off the top.
Legs.
Legs. We do this one, I have to go around if we do the other. We can move it here.
Quite a sacrifice of you, Terry, to
I know.
be here for this.
And just toss.
No, that's okay. I feel like.
Sorry. Unconsciousness.
And to notice, and just as a commentary for anybody watching, that if Terry were to disappear right now, Dwight would fall flat on his face, because he has his weight resting on his hands and is shifting his weight from one hand to the other, which is important for his body mechanics, and also to get a deep, effective move on the leg. He's able to develop a fair amount of pressure without really having to use any muscles, because he's just using his weight.
And then, well, we still show this. I don't know what with the
Light in the background.
we do the barrage on the back of the leg. You remember?
Yeah, you definitely do that.
And the 4, I know.
But that's the other 3-point contact that AMT exams on.
Don't worry about that.
And then from here we go into our range of motion. Now Ray was saying we usually bring it knee to chest on the exhale.
Opposite shoulders, what I do. Toward the opposite
He was
shoulder.
told go towards the opposite shoulders. And then from here we pivot back. Sure it does. And we can do a sciatic stretch from here.
That's where you want to
Oh, yeah. We have them fine-tune it themselves by bringing their toes toward their face. down, switch hands, and then we do different angles here. We either go one down like this, slowly, and you can just push, relax, and gradually move them into a stretch, or you can go more straight across. And sometimes we flop that foot over the leg. You can get more of a stretch. And people that are very super flexible will stabilize the hip to get the stretch. Then from here, we do our groin stretch. One hand on the knee, one hand on the ASIS. Roughly the same. Pressure on both hands to stretch the adductors and gracilis. And from here, we do our range of motion. And again, just trying to find that full range. And this nerve compression.
Foot?
We do the foot flipped over. I mean, we do show them, but the Reilly routine addresses it prone with the client down.
And then, like, towards the end, when we need to teach them something new, we show them the front of our foot.
But I do want to see the other people's nerve compressions on the legs, because we do want to get people to get more of the total squeeze rather than just the lean. We want to get the bottom side fingers involved into it. I mean, just by Ray's workshop and other people's work, I know how important that is. Yeah, granted, true.
Well, one thing I'd like to give some feedback on with different people is on the rolling and kneading, because yesterday it was really nice to see there was another variation on it that Ray had, which is to do a friction rather than actually a petrissage in rolling and kneading. And so he was actually just doing this kind of work on the back of the leg at least, as opposed to a movement like this. Now, Ray, is this the way you were taught, as far as you know, by Ryan? I'm just curious more than anything else. I think it's a real good move, but we've always done it with a glide across the skin, like that. Do you do it more like this with your
I
hands?
do it more like this, but I'm not sure if that's the way you taught me or not.
Okay, okay. And I think both of them are good and
Yes.
effective.
I'm really trying to concentrate on the deeper muscles, you know, when I'm grabbing.
Right, so he's doing friction work rather than petrissage.
Well, one big difference between what he just did is he was supporting his own weight. He wasn't leaning into it as much. And so he was doing more compressing between the two hands.
He was using his arms rather than his body.
Yeah. And so, again, as you said, if you want to get into specific muscles, that might be something that, you know, you do some of, and probably a combination of the two. One
Also,
thing that I remember is that, you know, a variety of a lot of different strokes on the leg.
Don't you all do some work on the top of the foot from this position in the Reilly
I do.
routine? I always did, yeah. Including this,
I do all of it on the
all the work on the foot from the supine position.
Well,
You
sit at
the end? But he taught it both ways.
you know,
Yeah, and I taught some for here on the top of the foot from supine, and then when you were prone, the bottom of the foot.
Sandra said he taught both ways.
Sorry?
Sandra said he taught both ways in Singapore.
Yeah, he did teach both ways.
you know,
work in both
I remember, yeah, he said to work it both times, but most of the time on the foot was spent in the prone position. But like you did some work, particularly as you say, on the dorsum and on the upper surface, and getting in between the tendons there and working along the metatarsals and all that, and getting in there. But then repeating it again really from the other side. But then there's another big difference, which we'll see when we get to the other side, which is because of the addition of the headrest, which they hadn't invented by then.
Adjusted.
It does, wow.
Now, one thing is, Ray, do you, on the calf like that, do you do that, like what they were doing with the knee flexed?
Sitting.
Let me hold it while you show
There's a second way too. Like this.
I don't do
She
that
taught-
now.
No, I don't either much, but Riley did teach this as well.
I do the back leg mainly when the person turns over.
Right, I do too.
Well, you can also let the leg come out and work on the back of the calf too. I don't do it this way, but you can do it this way if it's easier.
Now, in terms of when you were taught, Inga, do you remember, the emphasis in terms of how much calf work you did that way?
Not very much. There wasn't much emphasis on the calf that way. But I do it this way because it's easier for me than when the person's turned over. I also work on the calf, in a prone position.
Yes, I remember primarily doing it prone.
Yeah. Well, I work a little prone, but mostly in the supine position.
I gave up on that because I just don't like that extra lifting the leg and sitting down, and it kind of breaks the flow of the work on the leg.
It depends too on
It's good, it feels
how much
good.
work the calf needs, In this position too, you can work around the knee. And this is one thing that Dr. Reilly did. He always worked around the knee because people have a lot of problems with their knees. And then you always have to be sure and hold. Ease the foot down. And also when you bring it down, you can stretch. And then I'll work on the feet here too.
I guess
And
one
also you can do
advantage,
some work on the hip here. You can get in this joint and work. If you rock the leg, you can get in the joint here. And feel the condition of the joint and some of those tendons in there. Sometimes there's quite a lot of tenderness there. It feels a little tight. And moving the joint back and forth, holding your thumb in there and moving the knee back and forth. If you do that, you can feel that those tendons roll under your thumb, and you're not actually using the thumb pressure to do it, but you're using the body of the person. Right.
Much easier on you.
Yeah, much easier.
And more effective too.
Right. And then you can just use the heel of the hand and go right on down.
Tension fascia ladder.
Right. Because in women particularly, this needs a lot of work. And then the attached part. And sometimes you can just put your thumb in there and push it back and forth. How's that feel? Wherever you feel the tightness. But there are a lot of ways you can save yourself by, leaning, by using the body, by moving the body. There are other areas too where you can do that. You can move the body and you can feel those tendons underneath.
not fine with clients who,
Well,
Yeah, show the toe work that you do. Go ahead, please.
I like doing feet.
I like that you like doing feet too.
I just really get in all around the ankle. He stressed working around the ankle. And just like you do around the wrist if you work the wrist that way. And again, if you put your thumb in there and move the foot, it's much easier on you. You're not coming in here like this, but you're doing this, moving the ankle. And And I find this always feels good, is to get to make a fist and then just turn your hand as you come down. And just stroke. Between all the toes. And this loosens up this whole area here. Just make opposite circles with your hands and put the toes right between them where they attach there at the foot. And then you can work on the individual toes. And I always like to work a little. I do a lot of work on my knees. Just on the underneath part of the foot too. And I find this is easy for me. Easier than when the individual's on the other side. And if you get into the foot reflexology, you can work on some of the reflex points of people. And spread out those bones there. And then flex. You always have to be careful when flexing the foot, not to push on the toes. I've had people push on the toes like that. It's very uncomfortable.
I do that.
Always get your. You do. You stretch them.
But not from this angle.
But you have to be careful about not to, because some people flex the foot by pushing on the toes. But just
Yeah, it's good to do them, but then, not to do the toes when
It's
your
all right.
intention is doing the
Right.
ankle. Right.
It's just to stretch,
Good.
and again to lean into it. And then pull. And then you can rotate the ankle, and,
You do that also from the other side.
well, you can do it from here, or you can do it from the other side. You can do it here,
Mm-hmm.
or you can do it from the other side, or you can do it from both. I guess I do it from both, because I do more footwork from the other side.
You do the toes like this,
Yeah.
and then you rotate the joint like
Rotate
that.
and pull it.
The only thing I again like this myself, and look on this side of the Achilles tendon like that,
Right.
like that, and then work from the ankle back like this,
Yeah,
and then
I-
back like that.
I do stretch the Achilles tendon from the prone position, because then I can see what's going on a little better.
The only other thing that I know is this, flexing them back and
Right.
forth like that.
Yeah.
When I do the end, kind of pull as far as it'll go, and then do that. Try to pull it out of joint.
Try to make it crack, huh?
But I did that once and dislocated a guy's knee.
The knee, I don't worry about the knee
I
usually.
don't do it anymore.
Yeah, if they've had knee injuries, you
Yeah,
run into trouble with that.
that's where you need to know
Yeah.
about.
So I think advantages of doing the calf and the foot on the person's back is that, depending that they don't get all stuffed up, that you're spending less time on the back of the leg and the back. You're spending less time on their belly.
Time to turn it.
Flip side.
Well, this part,
Yeah.
this is the part I like to do before I volunteer to do this. This is in the book too, this is in the book side. This is where I squeeze the toes. And press them back a little way. But you sort of have to be real aware of what you're doing.
Right, and so
you're squeezing them out.
how much arthritis there is. I
Yeah.
work on a lot of older people.
Oh. I just try to rotate the foot as far as the ankle around in every direction as far as it'll go. And then, one of my favorite parts is doing the foot on this side over here. This is a problem with the headpiece because you got longer distance to reach up here than the way we used to have. I like to work the cushion of the toes like this and then push in right there on that where the toes connect and then just work on up to the main part of the foot. I usually use the inside hand for the inside the big toe. I'm going a little bit faster than normal, just for sort of demonstration purposes. All of the pressure is up in that direction. And then to work the heel, this is not necessarily a Reilly technique. I don't know if I should be doing this or not, but anyway, that's what we're doing.
You can show us.
You can even rotate the heel a little bit. Which is,
Well,
which is good to do.
that's an idea,
A
yeah.
lot of people, not in everything.
Okay, now I try to work the outer edge of the heel with the thumb, pressure going in toward each thumb like this, and do small rotating motion. I just started including this in my massage because somebody did it to me one time. It felt real good, and so I included it in what I do.
Yeah, he did a lot of that. He would starting down here and then working around and then down the Achilles tendon.
Right. And sometimes I do this movement that you do from the other side. Do it like this, and I do this for a while, and then come down and do this. And always end in with a stroke up. Well, the last strokes are up toward the leg. And one habit I got, which I felt like if I didn't do, where's the oil? Felt like if I didn't do this, I was sort of shorting the person, not giving them a full, really good massage if I didn't oil their Achilles tendon like this.
Oh, yes.
So I had to work some oil in there. 'Cause a lot of them I found were dry, dry tendons. work that in like that.
That's good for lymph draining. I mean, you're doing a lot of lymph drainage there too.
Mm-hmm. I try on the upstroke here, try to dig into thumbs between those muscles there.
Now, is that your nerve compression you're doing there?
Yeah. This is my nerve compression. I don't know how Harold will do it. You do 2 or 3 strokes, each one successively lighter. Now I usually just end at least with a gentle pull of the leg, because all this pressure has been shoving the leg back up into the hip, so it sort of pulls it back down.
There's one thing, I know when anybody works on me, my knee is always uncomfortable. It hurts. And I've gotten so that I just put the foot up, because I mean, I'm supposed to.
I put it on my shoulder. I
You
work
do it on your,
sometimes
right,
on my
on your shoulder.
Wow.
From
And
that position,
and
it's
then
real
I work on the
interesting.
back of the leg because it relieves the pressure on the knee. But putting it on the shoulder, yeah, that's another way. of
You
doing
really
it.
get a lot.
Right,
You
you
can get,
can get a lot of leverage in there without putting pressure on the kneecap, which is very uncomfortable for me. I don't know how it is for other people, but I don't like it. It hurts.
When does the pressure on the knee?
Well, when you're working behind the knee, or even when you're working on the back of the calf, or even here, then I always work in this area by putting it's on my leg.
Oh.
And then you can work back in here too, more of that, lymph drainage.
So when the knee is bent more, then you don't feel it.
You don't get the pressure on the kneecap.
Yeah, I think
Now,
that's real variable
It
from
may
one
not bother
person to
other
another.
people,
Yeah.
but it definitely bothers me. And I tend to tense up when that happens. As soon as somebody starts that, I feel my kneecap tightening up, and I tighten up.
I mean, to hold it down.
Yeah,
I can do it.
that's good. Right. Now, one thing is that again, it used to be, I'm going to switch legs here.
Okay.
That the tables didn't have the headrests, and so therefore the foot was at the end of the table. And so a lot of what he would do would be working from this place, but a foot or so closer. So about the only way you can really approximate that is removing the leg out here and working from here. So I'll demonstrate as if, had the table been shorter, working from here. And then the whole question of what to do with the leg was that he would have the little way he taught me is putting a foot right here, and that gave you 2 hands free to work, and the leg was up there.
And that would eliminate the pressure on the kneecap.
Right. And then you can really work these calf muscles well. See, because now I can put my whole body weight into this.
Great.
It's interesting, yeah.
And I can also control, I can control the position of the ankle and thereby either tense this muscle to work it one way or loosen it to work it another way. So I can really do a lot with these. See, I can loosen it to really, to get in between the different bellies of the muscle, and I can tighten it to be more real work. And we can get into these areas here very nicely. So actually, without even moving the position of the hands, you can either work the back, work the sides, work the front, and just by changing the relative pressure. And one nice thing about this position is when you do get into the foot work here, see all that work you're trying to do there. See, I can you can put as much pressure without any work at all as you can. You can put more pressure than anybody can stand. in this position without doing any work. And you know, if you do that one and then you goes back, and doing these, you know, just very easily.
Hmm.
Stretches, and you can help a tremendous amount of force on activities. Sure. You do rotation pretty nicely. Toes. It's usually too oily to do by that point.
What are you doing? Pulling?
Pulling and sort of
Rotating?
yeah, wiggling. It's sort of like the fingers, except they're kind of short, so it's hard to do much. But it's feeling, sort of wiggling, twisting back and forth to find the neutral position, and also traction, and also a little bit of rotation all at the same time. And then as part of it, also just bending into a flexion position. So it's all those little bit of details. And then you can still do the back side, using your knuckles in between the tendons. So you can still do a pretty effective job on the front side of the foot even. And work getting in as you're getting into the joint. Get too into all that. Then the nerve compression. And after working the leg, and so there was some question before about the different strokes. He used a lot of different strokes. And shift the weight back and forth. Depending on what you're going. But then, as far as the
Pressing and pull.
everything.
Whole hand, he's put his whole body into it.
And also I have a lot of body weight influence, yeah. Fall forward. So I'm just on the verge of pushing her up the table.
Could you also show the flexing and extending for me? Maybe you want to get along the sides of the foot?
Well,
Yeah.
Yeah.
see,
Yeah, that's the way you showed us, right?
if I want to do dorsiflexion, see the Achilles tendon, these muscles are some of the strongest tendons and muscles in the body, and so what we usually think of as enough to do a stretch isn't really doing too much. So if you really want to do an effective stretch, assuming they don't have any injuries or anything you have to be worrying about there, you really need to, you can't really develop enough pressure here because your hands are unstable, they're going to fall right off. So really, I find that I'm going to have to get the heel of my hand, put it right in here, there's a groove in here, so it's more stable, it's not going to slide off the other side. And I'm going to brace against my hip. That, or maybe brace against my chest, either one. So I got my thenar eminence in this groove here, so it's stable. I can control the position, so I'm not torquing it out or in. And I can develop a lot more pressure. I couldn't develop as much pressure by pushing on the sides here. The sides were still flattening the arch, which probably isn't such a great idea. Whereas if you put your hand in the middle, you're not flattening the arch so much as you do this. And then, then doing the work around it. This first showing Achilles tendon.
Also a move that I recall that we didn't do here today, which has to do with standing, holding the ankle like this, and doing an eversion an inversion stretch of the ankle, right? And then a rotation like this, too. Sure. Which is pretty simple, pretty easy to.
Yeah, we have that in what we teach.
Back.
The back. You're hanging right in there like a trooper, Terry.
And she's memorizing every word of this. Can you get that up?
Butterfly stroke, thumbs, fingers together, just to effleurage the oil on. Flaring out over the shoulders, flaring out at the hips. And a variety, sometimes coming straight back up along the spine, sometimes coming up the sides a little bit to spread the oil. From here, to help spread the oil, we go into our push-pull, either on one side or we can extend it to the entire back. From here, we go into our trapezius and posterior deltoid work with the thenar pad and heel of the hand. Up in the trapezius, again, pretty much just body work. Doing some work on the scapula, infra and supra. After we do that, we do our scapula work. We circular friction around the scapula, and the rhomboids and the like. And really, we just have them go right around the scapula. They lose it a little bit at the joint. But then you're on the lateral edge of the scapula and you just work along that edge of the scapula, and you can flip their arm back to expose it some more if you'd like. And then we just have them smooth that out. I go faster than we usually go. Then we usually switch sides and do that to the other side. And then from there, we either do some trapezius work either from the back here or from the front. And then from there, we usually do cervical stuff. I do so much other stuff. But we do just, again, some people do this with their thumbs, we were taught, but I prefer my fingers to get in there. Again, in the lamina groove on the cervical spinalis muscles. From there, we move into our up and out stroke. Lamina groove, one hand on top of the other. Spinalis, longissimus eventually. Costalis as we usually go a little wider maybe each time we come down. And sometimes we teach them to extend out over the back of the iliac. We glide back up and work out again. And again, the top hand giving us some pressure. Maybe the second time a little bit more pressure. And maybe spreading it a little bit further out.
Do any work on the hips?
Sure. After that, we would go over and do the same to the other side, and we do our nerve compression with our V stroke. Count the vertebrae. Now, Ray, when you were showing it yesterday, you know, you switch when you get down here low, you switch to
Only
your
because of
thumbs.
convenience. That's not the way Riley necessarily taught me, it's just,
Yeah.
it feels easier for me to do it by switching that net.
Our hip work isn't as extensive as a lot, but what we do is then we usually cover the back. We make both hands side by side on the glutes. We start maybe with small circles and then gradually make them bigger and try and loosen it up that way. And then from there we go into our sacrum work, starting along the bottom edge of the sacrum, circular friction, and just loosening up all those attachments where the glutes attach on to the sacrum. Moving up to medius and minimus. Okay. And then we usually go for some piriformis action. And then we usually do some ischial tuberosity work. You know, and from there you can just feel the hamstrings where it's nice and even all the way along there. And then we usually soften it up, but again, we don't show anything on the sacrum, and yet I always work there. And then I would flip over, do that to the other side, and then we do our stretching, our diagonal stretches, where we hook one thenar pad around the scapula, or you grip the scapula, and the other hand goes to the opposite hip. If we've got enough slack in the sheet, we just add a little stretch, and then we can diagonal the other way. And something you showed right down the middle, which is always. From there we go to our finishing strokes. Thumbs right next to the spine, making 4 short lengthening strokes. Each one gets a little bit longer. Always the pressure as we go down, the thumbs right alongside the spine. Stroke. And then once we've went the length of the back, gosh, I should have done your left side, Terry. Then we would go light, one light stroke down the length of the back. And then we would go one medium stroke. Go one heavy stroke. Back. Medium stroke. Slow motion, huh? And then we would go to a light stroke, and Kim Berkey said that this was always so very, very important that this last stroke be as slow as you can almost possibly make it, to slow their nervous system down to crawl.
Which of course depends also on whether you have somebody that's going right back to work and they're seeing you at noontime.
Okay, never make it.
Yeah, versus somebody who you're primarily trying to relax. But yeah, you can easily put people to sleep.
Dr. Reilly used to say on that last light stroke, he said, make it so light that let the body come up, rise up to meet your hands. I thought that was such a beautiful way of putting it, you know. So light that you're hardly touching. They have to rise up.
And then we do the components after that.
If you
do?
want to.
We teach the students.
Just if you need to wake somebody up again.
Maybe somebody can show some other hip work because we don't show, I mean,
Nerve system. You feel that same way? The difference is in the way you do that same stroke would
Yeah.
work on different parts
Well,
of
there
the
were
systems.
there were different readings where he'd have you start in different places
Right.
depending on what the need of the person was.
Right.
And then I don't, you know, I start down here and work back up again. And this is when I can usually feel if there are any problems.
That one doing a finger on each side of the spine is a whole different
It's
thing, in that there you're just pushing straight in, whereas what she's doing is moving the muscles away
Yeah.
and out from the
he said
spine.
up and away from the
Mhm.
spine, stretching.
Right.
And you can also feel with your fingertips, you know, where there are any, you know, specific, like here, you know, that's, and then sometimes if I feel a place like that, you know, I just get in there with my thumb and
So
work.
it'd be to work on the muscle rather than
Right,
the nervous system.
right. And, because all the time you're working, you're feeling where there are problem areas, and, I mean, people don't need to tell you where they are.
No.
And lots of times you can find them and they don't even know they're there until you touch them. Well, that didn't hurt till you touched it.
Well, those 4 patterns in the Cayce readings, I think one of them was only given once for a particular pathology. And the other 3
Right.
were a little more general, but not much. The main one was to work down the
Yeah,
spine. He never
this-
said to work back up.
Squeezing is good. So that, and then what I do on the hips is not, it's, you know, it's just what I do. Because I only work on women, and they have, a lot of women have hip problems. Derek and I have worked together on this. So again, if you raise this foot, and you can get in here with your thumb, in the piriformis, get right on it, find out where it is and get right on it. And then you can, if you move the foot back and forth, you know, you can feel it rolling right under your thumb. And I wouldn't tell students to do it, but you do it with your elbow, and, you know, you've got to develop sensitivity with your elbow.
Because you're also right on the sciatic nerve.
Right, right. So and when you do it, you keep your elbow, you know, you don't bend it very much, and you can feel where it is. And after you get used to it, and, you know, you kind of watch the person, you can kind of tell how much pressure to put on. But you have to go in easy at first, because anytime, I don't think it's a good idea to teach students to work with their elbows, because you know,
You don't know how to
so
adjust the
you know,
pressure.
I don't really like to get into the elbow work. But also, working on the back, using the forearm, you know, you can do a lot of work with the forearm, just going back and forth. I don't have very much oil on there. It's kind of pulling the skin, but it covers a big area. And also, it's easy on the body. You know, you can do it like that. You can even reach over and do the other side, and look around the other side and do it. And yeah, and here you can also on the hips you can work with your forearm. You know, and in this area here, just work across here. Now this is something that anybody can do, because you're not in danger of putting too much pressure, and it feels good. It feels good to have the whole hip area as well as doing this movement, which is good. That's the only thing I'd have to add. Forget about the elbow.
Ray, do you want to show the signal?
Well, that wasn't the right thing, but I did want to, excuse me. I don't remember starting the back the way you did. It was completely different.
No, I don't describe that.
No, I mean the way Jack
Yeah,
did.
right. But I don't think it matters a whole lot.
Well,
How you start.
just for, probably not, but I just wanted, just for the record.
Yeah.
Just start out by covering the back of the oil like this. And, starting like this. It's like, this is the way I remember it. Maybe other people may remember it differently. This is just loosen up the whole back before you get into any specific motions along the spine. And I normally go to the other side and repeat that, and then get into this like this. But this part here that you were doing like this, I do the same thing. But if I remember correctly, he tried to teach it doing it from this side, pulling across like that.
Yeah. Well, I've seen him teach it both ways. It depends on the person, you know.
Do you remember that?
Yeah, so you're probably a little shorter, and that might
If
be.
you're
Well, I do
taller.
it across like this now,
Yeah.
but it seemed like I remember him teaching it. across
Well,
and I can't do it as well this way.
Yeah.
As I remember, it was mostly the opposite side, but the thing is that rather than having to do only one side until you got around to walking around the other side, he said mostly do the opposite side and then do a little bit on the side you're on just for balance. But primarily when you're, the majority of it is done on the opposite side.
The only other thing I can, seems like that he taught working around the ball and socket joint here, like that. You remember that? Anything about that?
You have to work around there, and then he sort of did some circles, to get in. You can kind of feel the places, working here, and then the ischial area showing there, and then to sort of do it in lines, basically 3 points, and then to work around and sometimes to do the movements, although that was only really specific. You wouldn't usually do that in a routine massage. Again, most people that he saw were 210s, so you could be relaxed. You wouldn't be moving things around if it wasn't necessary.
There's a stretch that you can do too, but again, you wouldn't use it on everybody.
Rear hip rotation.
And you'd have to kind of see how far you
Well, you teach that in advance, Francis, right?
I show it, I don't stress
You
it
can-
much,
you can
but it's hard to
rotate.
do.
Or to rotate it
also
too.
rotate the hip, you gotta get near the edge of the table. Slide it.
She's willing.
Rotate my hip.
That's another way of doing it. There's a lot of ways of doing the same thing, and sometimes if you're working on somebody every week, a little variety is good. Try something different, and they think, oh, this is. It's part of the psychology of doing a good massage, I think, to have a few tricks up your sleeve. Or they'd come in and they have a particular pain and say, oh, well, I want to do something with that, and just do something.
The other things up here in the sort of beginning, like when you're doing the general movements and so forth, also can again do some good shoulder work here. So he had particularly go down to the upper arm. Use the work there. And then you can also move the whole scapula, shoulder around and get underneath it.
I think Dwight mentioned putting the hand, or letting them put the hand behind the
This way, even without having them move anything, you know, if you want to just do a little bit of something quick, you know, you can around it. Just as you're still, you're just sort of doing the general moves at that point. All the other, whereas there's this, again, for a variety, like you're saying, it's good for variety, not only for yourself, but also the person. Sometimes then the next time I might do it that way, which gives a different area of contact and there's some variety in terms of how you're using it. You know, and you can get area of contact all the way from here to here. Good big area. Using them as a tool. And again, although primarily the work, it's just easier biomechanically and more pressure and so forth to do the opposite side, but for balance, keep some on the same side, and then when I'm around on the other, after working around to the other side, and although then I'm primarily doing this side, then I'll do something, so that way each time you're doing some on each side.
As we kind of wind up, one thing I have in mind is, we've had various people criticize us because we're not teaching the pure Cayce-Reilly routine, etc. What makes Cayce-Reilly different from Swedish massage, other than some of the innovations that he put in, like starting proximal and working distal? And
He always
working on
said that was basically Swedish massage.
Right. That's what I would think. He incorporated ideas from the readings, as far as I know, as best he could. From what was researchable in those days, it was hard to get at the readings for the spinal massage and other things, but he was largely working with his general education from his schooling, his intuition, and people he studied with himself, I presume. So it was, what we're doing is really just a good massage routine. And it seems to be very different from the emphasis that Swedish puts on, say, effleurage. We put more emphasis on some of the rolling and kneading and that sort of thing, but one of the things I think at the school we really need is to be verified and to say, yes, we're doing what Reilly, in principle, was trying to do in his massage routine. That it's not a matter of being a cook and following a recipe, but being a chef and learning how to really be a body worker by bringing it to ourselves. Ray has added his own intuitive stuff to it. I think we all have. I think it's important to recognize each one of us will have our own sensitivities, and as we follow the basic pattern of the way the body was laid out, as Reilly said, and as we follow certain procedures, that it allows for a lot of leeway, a lot of individuality to come through. Is that a fair summary?
I think that one of the key aspects to it is the being in contact with the body, which is sort of building on what you're saying. It's not a routine. I mean, you could mechanically have a routine down pat, but not be really doing the person any good, because you have to be feeling what you're doing, and a slight, like if you're working on the back, you have to feel, depends on the elasticity of the muscle and how it moves. If it's resisting and you want to just go through it anyway, then the person's going to get tense instead of being relaxed. So you may have to, at some point, you may feel it's tight, so you've got to pause. You've got to take that move a little bit slower. And after you do that a couple of times, then the muscle will relax, and then your move will be, somebody watching who's not extremely skilled might not notice that there's any difference. You might say, oh, you did this 5 times, but you really didn't. You did, one of these, one of those, 2 of these, and one of those, and each one was different, slightly different weight, slightly different timing, slightly different location, which you're not the apparent to the understanding body.
I remember a student once saying, well, then we can do anything we want on the body. And I said, no, because there are lots of wrong ways of doing things, as well as lots of right ways. So you have to kind of learn that discernment through your own talent, sensitivity, experience.
You also need the routine, so you don't even
Yeah, right. I know Ed Pankowski told me that he said Reilly, when he taught him, said, just be thorough. Just be thorough with the body. Do a good job. And I think what Ron pointed out earlier is important too, which we emphasize so much at the school, is that you care, that you make that energetic contact of caring. You're not just a technician, but you're an artist. You know, it's a very high art form to work on the body and be plugged into it and bring your energy and your healing sensitivity to it.
Also the delineation of the different muscles, feeling that was something that we talked about a lot. And that also makes a difference between, as you're saying, working just on the surface versus being aware with the fingers of different muscles and getting in, separating them because things get stuck together.
There's a couple of things on the back that I recall that was in the book to us. I just want to make sure it's down for the record. I asked you about it. One of them is the just downward pressure. Do you remember that? Pressure straight down the spine and easing back up. Do you remember that? It's actually right on the spine with a cushion on hand. Do you remember that?
I remember that. I
I still do.
Okay.
But anyway,
That's another one of those legal things, because
Yeah.
then you're teaching students chiropractic.
Oh, no.
oh no, you're just flexing the muscle actually, and probably no more than, or not even as much as doing the rotation on the
No,
wrist.
that's not at all.
Not doing
And then there was
traditional.
a stretching like this. I remember him teaching this, which is very difficult to do, but it was, that's what he remember him teaching. And I think starting like this, with the right hand this far up, and then a little further down, it's really difficult, it's move to do.
For most people, easier to get their hands crossed.
And yeah, do it both
Hard
ways.
for you to do that, because you don't, isn't it? It should be in the line, because you don't have to get up.
That's why those old tables, that's the only thing I liked about those old tables. They had those big supports running right along here. You could get up on it. Stand up on it. It's so easy.
Hold the table together.
That's the only thing that I wanted to add, except right at the end. The end, the way we did the end was, the way I did the end, as far as I can remember. These were all heavy strokes, and I just began alternating like this, which it feels really good to mold the hand around the back. And going down, they're all the same pressure and fairly fine. And then all down the back, just bringing back the hands with the, not putting any pressure on the hand and bring it back. Again, the first one of these, we did about 3, as I remember. First one was heavy, and the next one was a little bit lighter, and so you continuously lighten up with each sequential stroke. Like that.
And look at the Cayce readings and the importance he's placed on 5 plexes.
always
Whenever I
like
do
this.
Oh, go ahead.
That's it.
I was just going to say that what I've been doing a lot lately, and I think it's a matter of partly of consciousness for it to happen too, though, is to start here on the brachial plexus and do a nerve stroke, which I teach now in the second semester. And start there again and come across the scapula lightly. Then come down to T9, which is, he said, is the center of the solar plexus. Come back up. As this downward and outward stroke, then over the lumbar plexus, is sedating. And then S1 and 2 and out across, which I think is probably very good for the whole nervous system. And I'm working with a client now who had a reading from Lama Singh, who uses a lot of neuropathic work, which is rare to find these days. It's made certain suggestions for his nervous system to be worked on in a certain way. And he suffers from traumatic shock syndrome from being in Vietnam. And it's different from some of the other neuropathic work in that you pull up and work into the spinal area like this. But that's just for him, I think. Because ordinarily, I think this movement down and out like that from the center of these plexus lightly is very, very helpful and only very useful.
I think, you know, a lot of times you would do both, because you would come down and then also lighter and lighter and something. To finish together sometimes. But a lot of times it's still coming up. Another thing, which is,
Go ahead.
I say a whole other topic actually, comes to mind, is that we also just don't need one sheet.
Right.
Sheet on and off, so we don't have as much longer.
Yeah. That's where you learned that from, Francis.
That's what we all do.
Which if you get real good at it, you know, you can stand anywhere and make the sheet move anywhere, you know, by the right shot of flicks.
This is a personal observation. This had nothing to do with the round, but I've discovered when anybody would try to bring their hands back like this with a fingertip, it would freak me out. I mean, just do that, you know. And I don't know if anybody else was like that.
I'm like that.
I always
I can't top those light strokes.
Right.
Makes
So
my
I would
legs
always come
fall
back with my
asleep.
hands molded around, you know, never just a fingertip like that, because it was just
Oh.
freaking me out.
I like the learn.
And that's no, you don't want to be freaked out doing anything solid, you want to be feeling good.
No, I think it's through all of them. The only time I would ever use my fingertips is the very end of the summer.
That's like a nerve compression, right. That stimulates
That's just
nerves.
me,
All
though.
different strokes.
Yeah, that's really different.
Right, different strokes.
Yes, Ray, I know what you mean.
Okay, so
I
how
want
we,
to thank all of our presenters today.
Terry,
Dr.
can you
Harold
breathe?
Kornylak, Elaine Ruska, Ray Cullis, Francis Spohr, and Inga Price.
Me too.
Yeah, this has been great.
wonderful.
Sure, like this
Dummy there.
really been helpful.
Um,
You get the dummy?
Terry has run up quite a bill today.